And we want to welcome you to our seminar today and are very delighted to welcome Craig Phillips, who is a professor at the University of Ottawa. He is a globally recognized nurse scholar whose interdisciplinary expertise in nurse science and intercultural human rights law advances equitable health systems. As a senior lead, he co-developed the Ottawa Model for Curriculum Development, an evidence-informed framework now reshaping nursing education across disciplines and institutions globally. His fellowships in the American Academy of Nursing and the Canadian Academy of Nursing attest to his leadership in integrating human rights into health policy and practice. He's a founding member of the University of Ottawa Centre for Health Law, Policy, and Ethics, and has directly influenced policy on women's health, HIV criminalization, HIV and infant feeding practices, and 2S LGBTQIA plus health equity, and has translated research into rights-based reforms that guide governments, educators, and health systems to better serve marginalized communities. Please join me in welcoming Dr. Phillips, and we are very excited to hear from him today. Take it away.
Thank you, Monica. And it's always humbling to hear your bio read to you. So I hope that I can actually live up to the billing that was just provided. And I'm going to start by acknowledging that I am a foreigner to the land on which I am joining you from. I acknowledge that I currently live, work, and play on the unceded and unsurrendered territory of the Algonquin and Anishinaabe with my Red River Métis husband. I am an American-born Canadian whose ancestors immigrated from Sweden, Scotland, and Wales and settled on the traditional homeland of the Ute, Goshute, and Apache. And so as we continue to transition through my presentation today, and bear with me while I make sure that I'm able to advance the slides. Um, I want to give a bit more detail about my positionality and that. So in addition to my expertise that Dr. Safford read to you, I also want to share with you that epistemologically and philosophically, I most closely align with critical pragmatism. I am comfortable with being uncomfortable and navigating uncertainty. And I believe in equity, justice, diversity, and inclusivity for all. Now, a lot of the challenges that we encounter and that in our current time in the world in which we all live, I think really stem from different interpretations and different understandings of what those four terms that I just read mean. So, with regards to equity, justice, diversity, and inclusivity, oftentimes there are really critical caveats that are put on those that mean only for certain people or only for people who look like certain other people and that. And so I think we really need to try to shift that and really move towards a world in which we do understand and respect that the world and all of the challenges that we're facing in our world requires all of our worldviews and all of our world perspectives. And so on this slide, you can see some of the photographs of areas and people who are really important in my life. And so you can see pictures of us doing some advocacy on Parliament Hill in Ottawa. You can also see a photograph that was taken the morning of the October 18th No Kings rally that occurred in Washington, D.C. I was there for American Academy of Nursing business and actually wasn't part of that rally. I also have the photograph in the center of me in Botswana. Whenever I show that picture to my students and stuff, I reinforce with them that that isn't something that you should try at home. Those are real cheetahs, and although they are tamed because they were raised around humans, they are still wild animals and do still have the potential to do what cats do. even though they're not your typical house cat. And then the photograph on the Great Salt Lake Salt Flats is significant to me because that really is the home territory where I was raised and grew up. It also happens to be near the Air Force Base where the Enola Gay took off from the United States during World War II as it was on its mission to bomb Hiroshima and Nagasaki. So a lot of the human rights aspects and components are really rooted even in the territory that I grew up in. Um, Moving on to the next slide, I want to give a slight legal disclaimers. And the first point that I want to address, and the first QR code that you will see in my presentation will take you to the Pan America list of banned and flagged words. And I have highlighted the majority of the words that are banned or flagged for from the perspective of our current US government. And so an additional disclaimer is any of the legal discussion or legal perspectives that I provide during this presentation are only for academic purposes. I am not a lawyer. I do not have the legal right or the authority to give legal advice. If you have some legal concerns or that, I do have the potential capacity to reach out or to help you to identify different legal resources that may be able to help you through some of the challenges. Um, the next few slides will give us an opportunity to get acquainted a bit more with each other. Then I'll provide a historical overview of human rights and nursing. Then we'll transition and talk more specifically about health equity. Then I'll talk about and show you some of the work that I've been involved with in relation to influencing or advancing equitable health policies and some of the advocacy work that I have done. And then I would like to end with a call to action. And one of the things that I forgot to mention earlier on is that I am using a platform called Mentimeter. And so you will notice at the top that if you go to menti.com, you can actually access the interactive slides. And the next slide will be the first slide where there is an interactive component where I'd love to get to know a bit more about all of the folks that have joined in. Before I transition to that slide, I also need to acknowledge, in addition to all of you for taking the time out of your day to spend a bit of time with me, the other folks that I've had an incredible opportunities over the last 30 or so years to build my levels of expertise and understandings of both the nursing profession and the legal profession and the disciplines in both of those fields as well. And so here you see pictures of folks from the International Nursing Network for HIV Research, which I co-direct, and also a lot of us from the network and the Association of Nurses in AIDS Care, another organization down in the States that I've had a lot of opportunity to work with and that represented on this slide. I also would be remiss if I did not thank all of the patients and that around the world that I've had opportunities to work with or for to help them as they address both their health challenges and any challenges they have with striving towards human rights related issues or seeking health equity. For the Mentimeter, if you were not able to open it with the menti.com website, you can also use the QR code on this slide. And so I'd like to get a sense of where people are joining in from. And so if you just type in and let us know what city you're joining from, that will give us an opportunity to get a sense of who all is here. So it's looking like most folks are actually from New York State or New York, and so that's off. That's awesome. Um, I also have had a few opportunities to be in New York, and so I really appreciate every opportunity that I have to be in either New York State, whether I'm in upstate New York, which is just south of where I am here in Ottawa, or in down in the city and the areas around the city. So I'm going to progress to the next slide. And on this next slide, I would like to ask you so I can gain a sense of what professional roles you all are engaged in. So, um, if you can respond to that question. Okay, that looks good. So that helps me to reflect on and think about some of the ways in which I can gear some of the information and that I will be sharing with you. And then what is your profession or discipline? And we'll give it a minute. Okay, and we'll wait just one more moment and then we'll move on. So it's exciting to me to see that we have folks from both medical and some of what is oftentimes referred to as the allied health disciplines. But I'm also excited to see an environmental epidemiologist with us, folks that work in pediatrics and that. I'm always grateful for folks that work in pediatrics because that means that that's one area along the life trajectory that I don't need to engage in and don't need to build expertise around. That being said, and you will see later that I have done some work influencing infant feeding practices and better understanding how infant feeding choices and that are made. So, on our next slide, I want to read this quote, and it comes from the human rights activist and scholar Alicia Eli Yamin. And to deploy human rights to advance health and social justice, it is imperative to understand and make visible the recursive relationships between the global and local. Identifying the dissonance in perspectives and agendas is an essential entry point to effective advocacy and coalition building. And I've had opportunities to listen to Alicia present and that, and to hear the messages that she conveys through her book, When Misfortune Becomes Injustice. And the messages that she conveys, I think, really embody the ways in which I hope that our world will be able to move forward. And I know that right now it may seem like we're in very dark places in many parts of the world, but I think we always need to remain hopeful and continue to come back and re-engage in the meaningful discussions and dialogue that are required for us to continue to move forward. So, some of the key terms that I'll ask you to reflect on as we continue to move through my presentation today include human rights, health disparities, the social determinants of health, the structural drivers of health, and the kind of overarching concept of health justice. And I won't address health justice directly, but as we're going through, I want you to all reflect on and think about the ways in which health justice, and if we were to move more towards that direction, that may actually help us navigate the world in which we live currently. And so I have two more audience engagement questions. The first one is for you all to provide what is an example of a human right. So, from your perspective, what do you conceptualize or think of as human rights? And so the example that I have is the right to life. And we'll give Mentimeter a couple of moments. So all of these that are popping into the onto the slide are really good examples of aspects of human rights, and they may not be um, specifically defined in the ways that you all have, but the pretty much the elements that you all have identified are integrated within the human rights legal framework. And so on our next slide, I'm just kind of curious to find out from your perspectives, how many of you or when do you think, so what year did aspects of human rights emerge? So it's looking like folks are really thinking about the time frame around World War II, or potentially even to the end of that transition period between World Wars One and World War Two. And so, with regards to what we define as human rights per se currently, that is when that really emerged. And so it really started with the Nuremberg trials and ultimately the articulation and acceptance of the Universal Declaration for Human Rights. But as we can see on a slide after this one, and I have this slide here because in my mind, this is kind of how I envision or visualize the interconnectedness between all of us as humans with regards to the different influences that law, policy, healthcare, and that all have in influencing our health, and that a lot of times when you see these diagrams or models like this, sometimes people will refer to them as kitchen sink models, meaning that everything is in it and it's difficult or challenging for us to be able to test any of the tenets or principles of this. This model incorporates theoretical perspectives from social epidemiology through ecosocial theory, um, a lot of other different social sciences disciplines, as well as legal perspectives, are captured in it. And so this is kind of what goes on in my mind as I'm moving forward with the work that I do. And so on this slide, I'm going to start to transition and talk a bit more about the human rights legal framework. This photograph is a picture of when my partner and I were at the Palais des Nations in Geneva for the 16th Expert Mechanism on the Rights of Indigenous Peoples. I was fortunate enough to accompany him as his expert technical advisor on human rights and that. Um, so with that the early human rights milestones, we can see aspects of what are articulated in our current human rights documents that do go all the way back to pre-colonial times or to antiquity or early centuries in the Common Era. And so I ask you also to take note that there are a lot of different philosophical and religious underpinnings that do guide the aspects of human rights as we continue to move forward. This slide ends with Magna Carta from 1215, where we start to see topics related to due process emerging and limits on state power and sovereignty over subjects within those different countries. As we progress and move into what is termed the mid-era for human rights contributions, there's a lot more of the religious doctrines that are integrated in here. And Sublime Deus is a document that started to undo some of the religious doctrines that were related to the terra nullius or vacant lands in which the Catholic Church and some of the popes back in the 1400s had actually weighed in and advised the royalty, um, primarily the Portuguese king, that it was okay for them to go and colonize and take over the lands because from their perspective, those lands were vacant and it was land that was available for anyone to settle or take on. Then, as we move forward to nearly 1800, so in the late 1700s, we see the French Declaration of the Rights of Man, where liberty and equality come into existence in that context, and also protection from arbitrary detention. And then in the late 1800s, the Rerum Novarum talks about workers' rights and social protections. Now, that brings us into the 20th century, and I'm going to touch briefly on some of the principles that are integrated into the Universal Declaration of Human Rights, again from 1948. And so the principles of human rights are that they're universal and inalienable, meaning that everyone is entitled to them and they cannot be taken away from any of us. They also include equality and non-discrimination. So again, they're rights for everyone. And then they're also indivisible, meaning that all of the rights need to be considered and taken into account as a whole package. And so you can't take away one right without influencing all of the other rights. That leads to the concept of them being interdependent and also the concept of them being interrelated as well. So they do apply to all equally, and all have the right to participate in decisions that affect their lives. They also need to be upheld by the rule of law and strengthened through legitimate claims for duty bearers to be accountable to international standards. This next slide is one that I always like to share when I'm speaking with North American audiences. And a lot of times, um, my fellow American colleagues will be like, oh, America has this really great human rights record, and we're doing such wonderful things with regards to human rights. But then when we actually look at the treaties that the United States has actually ratified and made efforts to integrate into domestic courts and domestic law, we actually see that there are only three of those international treaties beyond the Universal Declaration of Human Rights that the United States has ratified. An additional consideration to take into when we're looking at the human rights legal frameworks is whether and how each country has actually brought those um, human rights instruments into their laws. A lot of countries will actually include reservations, understandings, or and I forgot what the D stands for. I apologize, folks. But what those are is basically a way in which that a nation or state will put limits on that international treaty framework so that either part or sometimes in essence the entire document is not taken into consideration in that national context. Each of these can influence the ways in which different members within society can strive for and achieve health and their human rights. So that brings us to this next slide where we can start to reflect on and see that additional work has been done since 1948 with regards to the human rights legal frameworks, and we start to see Islamic declarations related to human rights frameworks that come into being from the 1980s through the 1990s. And then we also start to see where nursing has contributed ethics codes that help guide our professional discipline. It's also important, I recall that there are folks who have medicine and social work disciplinary backgrounds. I encourage you all to look at your profession's codes of ethics to see what levels of um, attention that those professions have actually given to some of the human rights frameworks. Um, One of the underlying principles that we'll talk about or touch on as we continue to move through my presentation is the concept of intersectionality, which originates from critical race theory. I won't go into detail other than to mention that and also to highlight that there are a lot of strategies where folks are conceptualizing ways in which we can move from more qualitative understandings of intersectionality to actually utilizing mathematical and quantitative methods to help us better understand the concepts underlying intersectionality. Um, Earlier, actually, no, I didn't introduce this yet to you all. So when I talked about the structural drivers of health, Heller and colleagues articulated in the Milbank Quarterly the structural determinants of health. The terminology between determinants and drivers is still up for academic debate. And so I will use both of them. In this particular context, when I talk about structural determinants, I mean also structural drivers. And so structural determinants include things such as societal values, beliefs, worldviews, culture, and norms, also governance. And it can be governance within institutions all the way out to levels of democracy or yeah, uh, autocracy or that at national levels. It also includes the laws, policies, rules, regulations, and budgets, as well as any of the institutional practices as well. And so, from your perspectives, what does health equity mean to you? And for this question, you have a little bit more space. Um, than you did with regards to the word cloud slides. And so you have up to 200 characters to kind of articulate what health equity means to you all. And then on the next slide, we'll have an opportunity for folks, if you wish, to vote for the health equity cons or definitions or that you all are putting in. These are all really good understandings and not of health equity from my perspective. And I love having an opportunity to be with folks that have a solid understanding already of what health equity is. As I finish a little bit later, I'm really hoping that we'll have a bit of an opportunity to have some dialogue and that with regards to what health equity means to all of us, as well as any other questions related to human rights or that you all may have. So I'm going to advance to the next slide. And so if you all would like, you can vote for any of the answers that were given. And I think I only gave you an opportunity to vote once. So choose wisely, folks. And so even folks who may not have responded to the earlier question, you could vote for any of the options that other folks put in as well. Okay. I'm going to go ahead and move on to our next slide. So the one that shows as being the most popular was the one that's related to access to opportunities to maximize health for everyone. And so from our group, we'll go ahead and consider that as our primary definition. And so on the next slide, I also want to ask, and this will be a word cloud slide. So please respond to this question by giving us an idea of, from your perspective, what are some of the factors that influence health equity? Location's a great one. Others? Cost, that's also a great one. Socioeconomic status, availability, education. Yep. So time, that's a good one as well. I'm going to advance to the next slide. Later on, we can come back. So if folks want to continue adding to any of the um, embedded activities or that, you can. So on the next slide, many of you, I'm assuming, have already seen this diagram. Um, More contemporary representations of health equity will include additional panels on both ends of the diagram. So at the beginning, oftentimes you'll see reality where one of the characters, one of the people has all of the boxes and has all of the advantage and no one else does. And then also oftentimes on the just next to justice, you'll also see equality, which is one where there is no fence and there are no spectators and everyone is engaged and interacting. And I really like the way that transition is starting to help folks to be able to see what it is exactly that we're talking about when we talk about equality. And so I'm going to now talk about some of the contributions that I, as a nurse, have contributed to the scholarly literature and the work that I'm trying to do to influence national level policies and those types of things. So earlier I showed you the big diagram, the kitchen table or the kitchen sink diagram and that. Now I'm showing you the interpretation or adaptation from that model to include the areas and the groups in which my work has had the most influence. And I've worked with the populations that are listed here primarily. But I also, as I was looking at this earlier this morning, was thinking I probably really need to change the gay men one or add another group to include the transgender and gender expansive communities as well, because I'm doing more and more work with those groups as well. And so, one of the aspects that I was instrumental in when I was the chair of the policy committee for the Association of Nurses in AIDS Care back in 2012 was when the organization added our human rights pillar to the policy agenda. And why that's important is when organizations, especially national level organizations, are able to articulate their policy agendas, it helps to guide the work that that organization will do related to policy. It also helps to convey to other organizations and other people the ways in which we can interact and partner and advocate together. And so that has been a really useful component for ANAC to have that. Um, Earlier, Dr. Safford mentioned that I have done some work with regards to HIV criminalization. And so the work that I did in that regard really started from a study that we gathered the data from between about 2009 and 2012, where we were looking at multiple different factors that were influencing antiretroviral adherence across multiple different national contexts. And one of the aspects that we looked into was the associations between the legal context. So whether there was a HIV related criminal law in a jurisdiction or not, and whether that would have any influence on adherence to antiretrovirals. So we found a very small influence. And initially, when this work first came out, people were like, well, who cares? It's such a small effect size and not. The reality of it is, and if we really think about it, if our laws are just and equitable, we shouldn't actually be able to detect that people are being influenced in some of the choices with regards to their health care, especially in a scenario such as HIV, where it's critically important that people are tested and on treatment. And so then we worked collaboratively with the Association of Nurses in AIDS Care, and I worked with one of my graduate students to be able to develop and conduct a study where we ultimately interviewed close to 1,500 nurses across all of the United States to determine what their knowledge was about HIV related criminal laws. That is unpublished data, but our feasibility study is presented here. The areas that I've influenced with regards to women's health and gender equity include things such as working in 3 different sites in 3 different national contexts to understand the sociocultural influences on women's HIV or women living with HIV and their infant feeding choices, and that work has actually been cited in the U.S. Centers for Disease Control guidelines for people living with HIV, as well as the British HIV Association's guidelines for infant feeding in the United Kingdom. Additional research that I've been involved with includes the commentary that we wrote that came out last summer, where we were actually very much concerned and really, I'm going to use the word targeted, but I don't necessarily mean it quite that strong. But we were really questioning the wisdom of some of the institutions around the world that are trying to narrowly define sex and only to define sex as male or female or men or women. And so we did a little bit of a analysis of the literature and really articulated the problematic challenges that that creates. We also looked at some of the ideology from um, the ways in which those attempts to narrowly define sex are rooted in both philosophical or religious traditions as well as colonial perspectives. And the last study that you see here is a study that one of the PhD students, who is now a doctorally prepared nurse in Pakistan, has been leading, where she is trying to gain better understandings and provide additional or expand the literature with regards to the psychological distress and concerns and considerations that may be occurring with first time fathers. Her focus right now is on Pakistan, but she has done work that is more global in scope as well. So I've also, as I mentioned earlier, started to do a lot more work with transgender and gender expansive communities. Some of that work has been translated into the work that we did over the last couple of years and published with the Canadian Association of Schools of Nursing to promote equitable, affirming, and inclusive environments for the 2S LGBTQAI plus nursing students. And we propose these guidelines for Canadian schools of nursing. And then I also have been leading or co-leading or very actively involved in the LGBTQ plus expert panel of the American Academy of Nursing since becoming a fellow of the Academy. And this article here is a consensus paper that we wrote where we utilized the Yogyakarta principles um, and integrated that with specific steps that nurses can actually take to support the LGBTQ plus populations. Now, another one of our real recent publications is a article that will be coming out. It's actually already available ahead of print. It will be published in a special issue of the Journal of the Association of Nurses in AIDS Care. But again, you see here where we've looked at all of the multiple different social and structural layers and how those can influence and affect health and healthcare outcomes specific to HIV people, and also when we are encountering any new or emerging pandemics. The next two slides are just a couple of slides that I'm sharing so that you all can understand or can gain a sense of how I'm able to determine some of the reach of my work. And so this first geographic citation map comes from the Web of Science, and it helps me to better understand that I actually am having a pretty global reach in where my work is being taken up enough that it is being cited in additional literature originating from those countries. And then on the next slide, this is from Scopus. And real recently, so within like the last 6 to 12 months, Scopus has added an additional feature where scholars who are listed in Scopus, you can actually go to your Scopus profile and click on the Impact tab and see in relation to the 17 Sustainable Development Goals, which of those sustainable development goals your work is helping to influence. And so my work is influencing 7 of the 17 sustainable development goals. So, with regards to nurses and other health providers or practitioners, what are our roles and responsibilities? And so I ask us to um, think about our work in relation to or as analogous to a lighthouse. And with lighthouses for mariners, they're a beacon of hope to help guide folks through rough waters. And that's one of the ways in which I think that as nurses and health practitioners, we can advance the work that we need to be doing. So some of the specific things that nurses can do is we can advocate for structural change in our own workplaces. We can also testify for equitable housing, education, environmental policies, any of those human rights related or health equity aspects. We can testify or advocate in regards to those. We can participate in local health boards, planning groups, or professional organizations to influence resource allocation. We can also support initiatives that expand things such as Medicaid coverage or striving more towards universal health coverage in various different populations. We can embed social determinants of health indicators in quality improvement metrics in our own institutions. We can also train other clinicians to incorporate things such as cultural humility, trauma-informed care, and health equity frameworks into those curricula for clinicians, as well as other professional folks that we encounter or work with. And then we can also use nursing or other health related theories that address the concepts or help to expand conceptualizations of health equity. Now, when we're mobilizing our actions for our future, I am always reminded and I always think about myself as being Stadler and Waldorf from the Muppet Show. So we can be the two old guys that are sitting up in the box seats overseeing everything that's going on, and we can be hypercritical and everything, or we can actually be taking meaningful action to move things forward. As we're doing that, it's critically important that we reflect on and think about the political backlash and the backlash politics that we need to navigate. As we started, or right before we started, Monica asked me a question about whether or what Canadians think about what's going on down in the States. So I'm actually putting up a slide to reassure you all that we also have our own challenges here in Canada. And so the first picture on this slide is from the Freedom Convoy back in 2022, where they literally shut down the downtown core in Ottawa for, I can't remember how long it was, but it was a fair amount of time. And that created severe disruption, and that within our city, that movement also spread across the country and created challenges in various different cities and at some of the border crossings as well. And we also see here a story, and again, this one is from now a few years back, and that is the Alberta Premier who had proposed trans youth rules that fit into a polarized international landscape. Since then, the Alberta legislature actually has passed legislation that limits access to gender affirming care for transgender and gender expansive youth. and has also implemented or used a um, instrument that is within the Canadian Constitution that actually limits the ability of the courts within Alberta to challenge that provincial legislation. So we also navigate some of those challenges. Um, the next slide here also comes from the article on the commentary about the narrowly defining the two genders or the two sexes. And this comes primarily from the work of Kogan and Kamungi Kapoto from 2022, where they actually proposed this framework to guide policy development that's informed by the legal determinants of health and justice. I think that that also is a really useful tool for us to reflect on and think about is what ways can we actually mobilize and partner with members of the legal profession to help us to advance the work or to work with them so that they can gain our levels of expertise as they're doing the work that they're doing. So always working in collaboration. I'm not going to read the last slide, but again, this one really talks about how by us working together and working collaboratively, understanding and respecting the challenges that all humans face can help us to move more towards a just and equitable world. My disclosures are listed on this slide. I do want to point out that I have used some levels of generative AI to help with organization of some of the components. And um, I will end now by asking, hey, Ninau, Kikahi, or any questions. And I'm going to stop sharing the slides so that we can have a conversation.
Dr. Phillips, thank you so
Yes.
much for your important talk. My name's Amy McMenamin. I'm a second year health equity research fellow here at Cornell. And I want to thank you for your talk and thanks for walking us through kind of the historical and global framing of health equity in the context of your important work. And I was curious, you asked us in your talk what health equity means to us. And I'm curious, across the course of your career and all the work that you've done, how has your own definition of health equity changed? I'd be curious to hear about your experiences or findings or work that shifted your perspective throughout your career.
So I'm going to answer that with two different answers. So the first being, we are currently through the International Nursing Network for HIV working on a our ninth international multi-site study where we're actually looking at what health equity means for health practitioners in a context of HIV. So we have one component of that right now where we're doing a modified Delphi study to gain expert consensus from members of the network or people that they work closely with in each of their different countries, their understandings of what health equity means. Another phase that we're working on in regards to that is we're doing a scoping review where we're actually looking at all of the literature related to health equity in HIV. Now, our hope is that eventually we will develop a tool that could be used with health practitioners. And a step after that would be to then hopefully be able to gain perspectives from patients or people living with HIV as well. So that's one component. Now, the other part where you're asking me how my conceptualizations have changed with regards to health equity. Um, because I've spent so much time reflecting on the human rights, the health equity, coming from a very religious community and a religious community that is conservative to ultra conservative. I was raised in the Mormon church. And so many, many things are taboo, and that, including the fact that, as I mentioned earlier, I have a husband. Um, so who I am, every path that I've walked throughout my life have been influenced by various aspects of health equity or having rights denied in certain respects, or that as an individual. I've also been extremely privileged, and I can't emphasize extremely privileged enough to be able to work with a lot of folks from very marginalized and very vulnerable populations throughout my work who have been willing to share with me some of their experiences and some of their challenges as they've walked through their lives and that. And so by working with those groups, by being invited to share in some of the work that my husband does, his work and responsibility is in regards to the Indian residential schools, day schools, and 60 scoop survivors of the what I frame as the failed child welfare policies here in Canada that also extend down into the United States. Um, it is so humbling to be in the presence of a lot of these survivors who have gone through horrendous treatment, and that through the colonial approaches and the mechanisms and the ways in which we've tried to bring people into the Western settler colonial mindset and perspectives at the expense of not only their histories, their traditions, but their innate humanity. And so those are a lot of the things that really underpin why I do this work, why I continue to do it, why I remain extremely passionate about that work.
Thank you so much for sharing your experiences with us. I see we're right at 1:30, but I just wanted to thank you so much. Dr. Safford had to drop off a minute early, but I think we would all like to thank you so much for the time you spent with us and the important work that you've shared with us today.
Thank you. And I really appreciate the opportunity. When Vanessa and Dr. Safford reached out to me, I was completely flattered, but I've really loved the opportunity to reflect as I've built the presentation and that. I'm so honored to have this opportunity. And I wish all of you the absolute best as you continue with your day, your weekend, and the rest of your lives, because we all, I think, need to navigate some challenging times, and the only way we can do it is together.
I completely agree. Well, the pleasure was all ours. Thank you so much, Dr. Phillips.
Thank you
Thank you.
so much.
Have a
Yep.
great day.
Bye, everyone.